Thank you for joining us. I'm Guy Carrick with St. Elizabeth Healthcare in Edgewood, Kentucky. Today we're going to talk about a new total hip replacement surgery. With us is Dr. Matthew Grunkemeyer. He's an orthopedic surgeon with Ortho Cincy, and he practices here at St. Elizabeth. Dr. Grunkemeyer, before we get started, could you briefly introduce yourself and what your specialty is and what you do as an orthopedic surgeon?
Sure. My name is Matthew Grunkemeyer, and I've been practicing here in northern Kentucky for 12 years as a general orthopedic surgeon, and I've taken a special interest in minimally invasive hip surgery, including hip arthroscopy and minimally invasive hip joint replacements.
Okay. I think we can get started with, can you briefly describe this surgery and what makes it so different?
Well, I think one of the unique aspects of this surgery is we use a novel approach, which is an anterior approach to the hip, where instead of cutting through muscles or tendons, we're simply going between spaces to get into the joint. And we've also used some novel anesthesia techniques, such as spinal anesthetic, that enables patients to recover quicker from the anesthesia. The goal being just a quicker recovery and getting patients back up on their feet, going about their regular activities in a comfortable setting at home. And that was what the goal was with this approach.
Okay, and could you talk about what are some of the benefits to the surgeon and then some of the benefits to the patient?
Well, I think the primary benefits definitely go to the level of the patient because if they are a candidate for this surgery, and let me add, not everyone is, they're going to be able to have a recovery process that's in their own home, in their own settings, sleeping in their own bed. And I think that some people really appreciate the ability to kind of bounce back and have less downtime from what I would still term as a relatively major surgery, such as a hip replacement. In terms of for the patients and for the surgeon, I like being able to do a surgery where I feel confident that I can comfortably send the patient home and them be able to recover in their own setting. So I like that, being able to offer that as a service to the patients.
How would I know if I need a hip replacement surgery?
Great question. So typically hip pain emanates from the groin area, and patients will notice discomfort with certain activities or certain movements of the limb. Sometimes it will start off very subtle, but then they'll start noticing increasing stiffness and inability to do things such as tie their shoes or get down out of a low sofa, and maybe even take stairs or walk becomes difficult and may begin to limp. At that point in time, it's a good idea to present to an orthopedic surgeon or even your family doctor and get it checked out and see what's going on. And then we typically start with an x-ray. And you can still see arthritis sufficiently on an x-ray that you don't really need advanced studies like MRIs or CAT scans or anything beyond that to make the diagnosis of hip joint arthritis. And then from there, of course, we would try conservative treatments initially, not hop straight to surgery. Things such as non-steroidal anti-inflammatories, Tylenol, physical therapy, assisted aids, canes, crutch, etc. would be the first line of treatment. And if those treatments fail, then we would begin to discuss surgical treatment options, such as hip replacement surgery.
Okay. Approximately, how long does the procedure take?
Well, I've got a really good team here at St. E's, so we can safely complete the procedure in about an hour.
Oh, wow.
Yeah.
And then approximately how long does the process take from registration to discharge?
Well, if we're talking about the same day surgery, you would come in early in the morning. You have to wake up early. You eat nothing after midnight, and you present to the registration area. Of course, this would be set up in advance through my office, having met and discussed and determined the need for surgery. So day of surgery, you'd come in, you'd get registered, you'd meet your anesthesia team, and probably have already met them a few days before in the pre-anesthesia testing. You'd meet them again. You would undergo the appropriate preparations for surgery, have the spinal anesthetic placed, have the procedure completed within probably about an hour, and then be in the recovery room for a couple of hours, and then be ready to get going to go home. Now, because this is a pilot program, we want to be sure that we have lots of extra care for the patients once they're at home. So we're actually having them met when they drive home by a healthcare professional, nurse, who will help make sure they're comfortable in their home setting, that they can feed themselves and toilet and do all the important things that they need to do after this fresh surgery. And then they're followed up closely by myself and my team. We see them usually at 4 days, and then again at about 10 days after surgery.
That's a good segue. The next question I was going to ask, what happens post-surgery after someone returns to home? What's the next step for them?
So typically they're, like I said, going through their activities of daily living in their home setting. They'll probably have some physical therapy exercises to complete. I'm going to allow them to immediately bear weight. Just for safety, I'll typically have them using a walker and or crutches to initially start. And then as soon as they're comfortable, they'll throw that walker and crutches down, and they'll begin with a cane. And then as soon as they're comfortable throwing that cane down and they can walk without a limp, then they're able to walk freely without a limp. Some patients I have that occurring almost immediately. Other patients it takes a week or two. So it just depends on, that's a very patient-specific question, and I can't give you an exact answer of when you're going to throw the cane down. But I like to see it at least within the first month or so.
Okay, you alluded to this earlier on, but who makes a good candidate? When is someone a good candidate for this surgery?
Well, first off, they have to be motivated and want to have it done as an outpatient. That's very important. Just the psychological factors of, hey, haven't had major surgery, go home same day. Certain people are maybe not so interested in that, and so I would say that's important motivation. But besides that, they have to be in very good overall general health. They can't be on multiple medications. There is an anesthesia grading, and they have to be an anesthesia grade 1 candidate, so no chronic medications and a very healthy individual. So unfortunately, that rules out a number of patients who, at least at this point in time, wouldn't be candidates. They also need to have a lower body mass index, so they can't be very overweight because that can preclude the safety of being able to go home the same day.
Okay. And how safe is the procedure?
It's very safe. It has a good track record. Hip joint replacement has been occurring since the 1960s. Sir John Charnley over in England came up with the first hip joint replacement, because before that time these patients were really miserable, and it was almost a terrible diagnosis to receive of hip arthritis because you gradually got increasingly debilitated. And I've been to countries in the developing world where they still don't have this technology yet, and it's very sad to see the severe level of disability that end-stage hip arthritis can give. So I'm grateful that this surgery is available to us here in the States at St. Elizabeth, and we do a nice job at it, and I think it's a very safe, effective procedure. Interestingly, you asked, there's been some studies that the CMS, the government, Medicare, does on quality adjusted years of life. So how much does a single procedure really help someone's quality of life? And hip joint replacement was one of the #1 ranked procedures that we do that actually really helps people's quality of life after a successful procedure. That's what I love doing it.
Well, I think you just answered my next question. I was going to ask, why was this so important to offer this in the Total Joint Center as well as for OrthoSensei to offer the procedure? Is there anything more you want to add to that?
No, I just think, that's what's fun. That's what gets me up in the morning, is being able to, help patients and see them come in, hurting and maybe having some disability and not able to do the things that they enjoy doing in life. and being able to perform a surgical treatment that can give them kind of a new leash on life. And we hope to just continue to extend that with this new offering of outpatient joint replacement, and just kind of even hopefully cut down a little further on the recovery time and get people back up on their feet and moving and active even sooner.
Okay. And how much of a change do you see this in total joint outcomes for patients?
Well, you're right. Outcomes is a good word. That's what we're all searching for and looking for, is successful outcomes. We want people to see a marked improvement in their health. When you get something like hip arthritis, it definitely affects your health, both physically, mentally, in many different ways. And so we want to see those improved outcomes. And so we're always searching for a better way, to help patients to get them back on their feet and get them back to the regular activities sooner. And so I think this is just one of many different things in the world of orthopedics and in the world of healthcare, where we're trying to take the technologies that exist and apply them to improve patients' lives.
Okay. And I do want to remind viewers, if you do have questions, please use the comments section. Before we wrap up, Dr. Grunkemeyer, is there anything more you'd like to say about this procedure?
Well, I just want to emphasize that it's not for everyone. Please keep in mind that there's no shame in undergoing a standard hip replacement, which we haven't really talked about, but that's typically involves a couple days stay in the hospital. There's no problems with that. It's still a very effective procedure. This is just another offering that we're able to offer here for a select group of patients.
Okay. Well, thank you very much for joining us today. Again, if you have any questions, feel free to submit, and we will be answering those throughout the day. Also, if you are experiencing hip pain, by all means, share that with your physician. And thank you for joining us. This is Guy Carrick at St. Elizabeth and Dr. Grunkemeyer with OrthoSensing.